This is your lymphatic video specifically for any surgeries, any complications with your chest area, your breasts, your underarm, even your shoulder. If something has happened to your shoulder and you've had surgery there, or if you just struggle in this area with inflammation, with swelling. This question specifically asks for a double mastectomy. If you've had any lymph nodes removed, what happens is, imagine traffic on the freeway. Imagine a line of traffic because there's construction right here and everybody has to merge over into less lanes of traffic. And so yes, we can still kind of move, but it gets congested. It slows down the flow. And that's exactly what's happening inside your lymphatic system. So it's not that there's no lymph flow whatsoever. We just have a very decreased and struggling stagnant lymphatic flow, especially if there's lymph nodes removed through here. The traffic will redirect, it will find a way, but it's going to be slow, maybe some swelling, that's edema. Maybe you have chronic lymphedema that can happen after any type of surgery, but especially surgery related to cancer and lymph nodes. And so this will help move and assist some of that stagnant lymph and help with the swelling and the pain that's resulting in that. It's very gentle. Let's be nice to yourself. So the first thing we need to do is open up our major lymph nodes in the upper body, hands on top of your chest, gentle pulls down. And we are going to just stretch the skin down away from our collarbones. You will feel a stretch in this area of the neck. I just got a swallow there. So I respond really quickly to lymphatic work. I myself struggle with edema. I don't quite have lymphedema, but I have a lot of edema in my body from different surgeries. I've had 17 surgeries on my face from a near-death accident, and that causes a lot of swelling through here. So when I start to work the lymph system, my body responds quickly. You might not swallow right away, but that's one thing we know, that the lymph is starting to move if you get that salivating and then you swallow. Your next spot, make a peace sign. One finger in front of the ear and behind on each side. Gentle pulls down there. So if you've been doing these videos with me for a while, you'll start to recognize that these repeat. We always want to open up these major portions before we can start to move the stagnant flow. I think of them like turning the lights to green. The cars can't move if all the lights are red. And so we need to turn the lights to green so then the cars can start to travel and the traffic can clear. The next spot, at the base of your jaw where it meets your neck, little circles here. Be nice here. Another way you can do this one, this is the most important spot, but if you want to take a hand around the back of your neck and then cup the front, and we're going to do these little pulls down away from my skull, like so. And I don't want to grip too heavy. I don't want to smush my trachea or my thyroid. It's just a very light pull down on the skin. And that way we're gathering all of the lymph that travels 360 degrees around your neck. We have 700 lymph nodes in the body, 200 to 300 are right here. So we need to get them moving. Your body cannot heal if your brain is stuck in a dirty fish tank. Doctors want to drug the fish. I want to clean your tank. Okay, next spot, under the arms, gentle massages there, especially if you have pain and swelling. My number one rule, do not cause yourself more pain. Pain is a request to stop doing something. Pain is a request for change. So if it hurts, go lighter and lighter until it's more comfortable, and make it as soft as you possibly can. We're not going to get anywhere with lymph if it hurts. That is your body's way of saying this is going to swell more and cause us more pain and damage. Okay, so after the arms, right where the ribs come together, there's my ribs. Right below the ribs at the soft spot, here's my belly button. Little gentle circles there. So this spot is called your cisterna-chyli. It is the biggest lymph node in the whole body. Everything will flow through her, the liver, through our organs. We will go to the bathroom and release toxins. Sometimes this work can make you nauseous. I've had a couple of comments on here that they feel a little nauseous after, a little fluish after. And so what is happening, it's not as common. It's more rare to feel that way. However, if we're moving toxins through our bloodstream, sometimes we don't feel so great in the meantime. The first time I learned this, I felt incredibly nauseous and I had diarrhea for 3 days after, and I've been fine ever since, but I keep up with my lymph work now. So now that we've opened up 1, 2, 3, 4, and number 5. We're going to come to the side of your chest and the underarm area. I have another video for your arm that can be done with this as well. This one specifically for more of your rib cage area. So what I'll have you do, if you're laying down, rest your arm up here somewhere. You can even recline back on the couch and rest your arm up or out, just somewhere where you have access to under your arm alongside the ribs. And if you're standing, that works perfectly fine too, somewhere where you can rest. Take this opposite arm and wrap it around as far as you can reach around the side of your body. And let's go right underneath where that shoulder connects at the armpit. And I'm just going to gently pull in and release. It's a pull in and release. You'll notice it's a little bit forward and mostly in. Almost like I'm just trying to squish everything back to the center. Maybe about 5 to 10 there. Go a little bit lower and repeat. Now, if this bothers this shoulder over here, if it really hurts you to do this, get a loved one to do it. I'm actually working on a course. Right now I teach professionals and I certify my colleagues and professionals in this work in manual lymphatic drainage. I am currently working on a course for non-professionals that just want to learn for themselves, for their family, and to work on each other, your children, your babies, your loved ones, even your elderly parents, things like that. And it's very gentle work. And I believe it's work we all should know how to do. We all know how to brush our teeth. Why don't we know how to take care of our own lymph system? And I think it's something we need to work on. So keep making your way down. I'm about halfway down the ribs right now. Just cupping and pulling it in. And then once you've done along the side of the ribs, we'll come a little bit more over on top of your chest. If you're a woman, you have a breast, that's where we're going to work. If you've had a mastectomy, that's where we're going to work. Especially if you've had a breast augmentation that was cosmetic, any kind of surgery that was medical in your chest, a pacemaker, right? A shoulder surgery. And again, if your shoulder hurts in this position, let's find a good position for you. Rest it on a pillow somewhere, lay down, recline, get comfy. So I was on the edge of my ribs. I'm going to come a little bit more forward now. Same thing, pull it in, and I'm aiming kind of right to the middle of my chest. All the lymph will travel this way eventually, and I just want to encourage this pumping action for my lymph system. So our blood has a pump, the heart. Our lymph doesn't have a massive pump like that. It does pump a little bit. It has little tiny vessels that slightly contract and pump. However, it gets very stagnant the more we live life with toxins and surgeries and pharmaceuticals and alcohol and sugar and stress and breakups and heartache and bosses yelling at us and the car in front of us on the freeway braking, and then we have a panic attack because we think we're getting in a car accident, or we do get in a car accident. All of those things, the cortisol, the adrenaline, the lack of sleep, the less than healthy food, the less than enough water, impact our lymphatic system, and it gets stagnant like a dirty fish tank. So I've made my way a little bit lower on my breast. Now I'm a little bit across the bottom, almost like under my, if I was wearing underwire, under my underwire. And depending on the size of your chest, you can spend a lot of time here working this tissue. My hope is that this reaches the right audience. I'm wearing a black shirt. I try to not be too inviting for people that just want to watch me work this area. I want this to be educational for those that need it. Okay, next thing we're going to do, I'm actually going to cup my chest, my breast, a little bit of a push down, a little bit of a push up. Make this nice. So if you have had surgeries, if you have spacers in for a future surgery, if you have implants in, whether they were cosmetic or from post-mastectomy, it doesn't matter why we have them, we have them. If you've never had a breast surgery, but maybe you have calcifications in your breast, maybe you have dense breast tissue that they do mastectomies on and they keep watching and scanning, maybe we need to move the lymph and get more blood flow. And so then I would just come around to this side and kind of alternate like this. So again, you can get a loved one to do this if you have a loved one in your life that wouldn't mind moving around your lymph fluid in your chest. It actually feels fantastic, especially if you've had surgery or you just tend to be tender in this area. And I'm just slowly pushing one way, pushing the other way. And I think of it like a clock. So try to come all the way around many directions that you possibly can. Okay. Once you've done your clock and you've done your skin pulls along the side of your ribs and a little bit to the front of your ribs, then we're going to brush. And so I want to brush everything from here to the middle. Just brush it across. And I'm high. This is my collarbone up here. I'm brushing right under the armpit, on top of my collarbone. If you have a pacemaker, that's exactly where we're working. Go a little bit lower across your breast, pulling it to middle. And then go underneath. And you can repeat that for a while. So this brushing is super light. I feel like I'm just painting with my fingertips, and I'm pulling the lymph always this way, never back out. So if a car goes 2 inches forward and 2 inches backwards, we won't get anywhere. We always want to pull everything to the middle of your body. You're always aiming to your heart, but if we're working right over the heart, think middle of your sternum, because we want it to go actually here. That's our goal, is to get everything in through here. So let's say you did have some lymph nodes removed right here, and it was supposed to travel this way. Maybe this road is closed or stagnant. It will find a way. Maybe it will come up this way. Maybe it will come down this way. We don't even need to know where your brain has decided to send the traffic. We can still help. Maybe it's going this way. Maybe it's coming down this way. Okay. You will repeat that on the other side. First of all, okay, how does that feel? Because this side for me feels so light and airy. I can feel blood flow. This side feels heavy and dense. This shoulder feels lighter to me. This shoulder feels like it weighs 5 million pounds. So notice that in your body before you switch sides. Do the other side. Once you have, let's do those last final lymph nodes together. So it's at the diaphragm one more time. Under the armpits again. And even here, the one side that we worked, it feels really good for me. So hopefully you notice a difference if you haven't done that second side yet. And you can always repeat the side that needs it more often. This is as gentle as going for a walk, right? Keep it nice, keep it really soft. You can do this often. I'm gonna cup my entire neck, little pulls down. If you don't wanna cup, working right here is perfectly fine. Do the ears. I just like to go in the reverse order, almost like I'm just like putting things back on the shelf. Last spot on top of the chest. I love taking requests. Thank you.